Welcome to another segment of Thankful Thursday. And today I'm here in our Operating Theater 19 with Associate Professor Walid Barto. Thank you so much for squeezing this segment into your busy day between surgeries. The reason that we're getting together is we've been working together with the robotics team for quite a few months. And just before Christmas, we had the urgent need for a Trump operating table. And we reached out to our valued donor base to ask for their support. And we were so fortunate that 3 families stepped up in that really busy week before Christmas and answered the call. And I just wanted to share with the staff just how this all works when medical clinicians work with the foundation so that we can deliver really crucial equipment and the impact that it has on the surgical team. So maybe you could just talk a little bit about the functionality of the Trump table.
Great. Thanks, Jody, for the opportunity. So the Trump table is quite a unique table that connects wirelessly to the Da Vinci robot. And what that means is that it allows the robot and the table to move together. The advantage of that is that you are able to access different parts of the abdomen by tilting the patient while keeping all the instruments inside. That's a big advantage as opposed to the traditional tables that were used where you had to undock the robot and remove the instruments before you can do the change or the tilt. So the advantage of that is that you can have the access without having to remove the instruments, and therefore you're saving a lot of time. It makes the theatre run more efficiently, and we know how valuable theatre time is. So it allows us to save time, do what we need to do, and access different parts safely. And also, in the rare instant where an emergency situation arises, we can also access different parts of the abdomen without having to undock. So that's a real advantage, and to have it available when needed is a big plus.
Well, thank you. And I know it's been well documented that robotic surgery is also having a significant impact on patient outcomes. And it sounds like you kind of alluded to that, but is there anything specific you'd like to share with our fellow staff about that?
There actually has been some studies looking into the use of the Trump table, and so it has been proven in studies earlier when it was introduced that it does save time, like we say, but also introduce that element of safety if needed, which is really important. So I think the quicker the operation goes and the safer the operation is, it means that we got better outcome for our patients.
Well, thank you again. I know you have a busy schedule today. We're so grateful for your time, and it's such an honor to work with your team. So thanks again for your time today.